DBC, or Documentation-Based Care, is an organisation that develops and applies scientifically validated research, evidence-based therapies and technologies in the treatment of musculoskeletal disorders. Founded in Finland in 1991 by a team of medical specialists and researchers, DBC is now a leading company in its field, with clinics in more than 20 countries worldwide. DBC's treatment provides cost-effective and unique long-term results, even if all other treatments have failed. In this profile, I've travelled to Finland to speak with DBC to find out more.
Well, there are several unique points in DBC system. First of all, it's research-based, and we have selected the best available methods for the treatment of the spine, and therefore the clinical results of our system are excellent. Patients can expect pain to reduce, physical impairment to reduce, general well-being to improve, among many other benefits. Also, work absenteeism can reduce, and therefore the payers of the system appreciate it. Another very unique feature is that we collect the data of each treated patient into a centralized database and use the data for quality assurance purposes. And with the ongoing training and quality assurance system, we can reproduce the results throughout the whole clinic chain.
10 years ago, we advocated bed rest for acute back pain and reduced function for chronic back pain. There have been countless studies that have shown that that's not the case. It's what you need early restoration of function. Early restoration of function not only decreases the duration that you have the pain, but it also improves the long-term outcome. It restores function and it restores the ability to return to normal activities.
DBC has a network of over 80 clinics in 22 countries. To support this network, we have a vast array of materials available to us. We have manuals that support not only the back and the neck treatment, but also the maintenance, the facilities, the business development. Looking at that, we also have the technology within the devices that we provide. We provide training for the physiotherapists. We give them their initial training, but then we come back and that's available to them whenever they require that. We also have a look at business proposals if they need that to set up a clinic, and we also look at the research and development that goes on within the clinics. On a monthly basis, each clinic sends to a central point in Finland all their data. The data is then aggregated and sent back out again to each clinic so that they know on a daily basis how they're doing.
The first part is the safety aspects of the patient coming into the plan. The second part is the initial assessment, and the third part is the tailor-made plan that is built towards the patient's needs. The first part is the referral in by the treating doctor. The patient is then assessed and an individual treatment plan is then produced for the patient. The treatment plan itself consists of 2 visits per week for a period of between 6 to 12 weeks. The actual treatment plan itself will depend upon the severity of the condition and the patient's response to the treatment that they receive. The exercises themselves are targeted exercises. They use unique machines that can control both the range of movements and the loading provided.
Research and development is important for our company because of 2 different reasons. First of all, we want to continuously improve our treatment results, and therefore when we find something new to improve it, we will implement that into the system. And second, the payers of the treatment demand evidence on the procedures. And the reason is simple, that the demand in general for spine care is increasing, while the funds available are not. And therefore, we believe that in long term, only evidence-based treatments will be funded. This forms a competitive advantage for DBC already now and increasingly so in the future.
My opinion is that the strengths of this treatment are that it's evidence-based. The patients are placed in a safe, well-controlled environment, and that their treatment is for a known period of time. It is not an open-ended treatment. And ultimately, the strengths of the system speak for themselves with patients' recovery and improvement.
As we've seen, DBC is leading the way in musculoskeletal rehabilitation. So the question is, what is the vision for their future?
With DBCI, the package that we offer is not only a clinic where we're offering devices and we're offering support. The good thing about it is that we're offering relief to patients across the world. And the dedicated people at DBC International are highly motivated to enable this concept to be available worldwide to anyone, everywhere.